My name is Valerie Myers. I am actually a faculty member here at Pennington. I'm a behaviorist clinical psychologist, and I work on clinical research trials. So basically, I like to joke that at Pennington we do research from mice to men, and I work on the men part. I don't work with just men, but you know, I definitely choose to deal with the two-legged variety than the four-legged variety, and enjoy very much what I do. What I primarily work on is lifestyle change studies. So when people come in and maybe they want to stop smoking, maybe they want to lose weight, maybe they want to manage their diabetes, whatever it may be to have a healthier lifestyle, I'm one of the people that is the researchers on that. So I was very excited when they opened up the topic to talking about pain signals because, excuse me, like everyone, I'm getting over the sinus infection that everybody in Baton Rouge seems to have had for 3 weeks. But I was very excited when they said, what do you think about this concept of pain and emotional health? And I said, absolutely, I would love to talk about that because I think pain is one of those things that, well, first of all, every human being has experienced it. It's a universal experience to have pain. And I laughed because I woke up today with a crick in my neck and I was like, isn't this poetic? I'm going to be talking about pain today and I have neck pain. And I was like, fabulous. So that's just like little gentle reminder. But, you know, oftentimes what's overlooked is that connection between pain and emotional health. So what I'm going to talk about today is I'm going to do a general overview of what pain is because I find that there's a lot of myths about pain out there. And then I'm going to talk about something called the biopsychosocial model. And then I'm going to talk specifically about stress and maybe give some techniques on how to work with that. So this is the lit up brain up at the top for those with migraines. Sometimes that's what it feels like, your brain just is on fire. But so like I said, we're going to talk about what is pain, the mind-body connection. Just a show of hands, has anybody heard of the term mind-body connection? Okay, excellent. And then understanding stress and then pain reduction techniques. So I always like to start off with a little slide or a quote or something. And it says, well, doc, the pain starts in my husband's lower back, then it travels up his spine to his neck, then it comes out his mouth and into my ears, and that's when I get the headaches. So I absolutely love this because I was like, is this not true? Because sometimes the pain that we experience has very little to do with what we do ourselves, but sometimes the influence of others around us, correct? So what is pain? Well, quite simply, kind of the cosmetic or the clinical term is that it's a sensory and emotional experience of discomfort. 20 years ago, you would have not seen the word emotional in that definition. So it used to be just a sensory experience of discomfort, but now we have the emotional experience because we have found that pain in and of itself has a true emotional component to it. And then also, I just like to let you know that is the single most common complaint that individuals present to their physician with. Single most common complaint. Most people don't go to their doc. Maybe they go if they have a bad sniffle, but they'll get over it. But when a person is experiencing continuous pain, they typically go in and try to see a physician. Now, show of hands or head nods. Anybody in here ever have pain? Right. Anybody ever go to the doctor and have a hard time figuring out what the culprit was while you were experiencing that pain? How many people just say, oh, that's just the part of getting older? Being told that, right?
Yes.
Some of that, in some ways, is true, but that doesn't mean it's completely true. I mean, yes, there's the maturation process. You know, from the day we're born, we're on the pathway to death. That's really optimistic, I know. But it's true, and along that process, you know, pain does occur. And pain is a good thing. We're going to talk about that. So we're going to talk about the different types of pain. There's acute versus chronic. I'm going to hold off talking about this one because I have a different slide that has a lot more detail. Then there's malignant or benign. There are different disease states that occur. I'll take the example of cancer. That typically people, when they have a more serious or malignant cancer, they experience more pain associated with that disease versus if it's a benign type process. So, for example, a tumor that may be malignant is more painful for the individual than a benign tumor. Makes sense? Doesn't mean that they're not both painful, But typically, when there's something a little bit more sinister going on, it does have more pain to it. And that's for a very adaptive purpose. It makes us seek treatment, because if it didn't hurt, we would ignore it, right? So it's one of the signals that gets us to be proactive. Then there's continuous or episodic. Simply, continuous is pain that you have all the time. It's ongoing. Now, it doesn't mean it's necessarily there every day, but it's kind of your friend that never leaves the house, right? It stays with you forever. Some days you're going to have foot pain. Some days you're not going to have foot pain. But you're always going to say, when someone says, hey, do you have any aches and pains? Oh, yeah, I'm a person who has, foot pain or heel pain or neck pain. Yeah, that's me, but today's a good day. And then there's episodic. This is when people might have it, and then it goes away, and it goes dormant for quite a while, and then it comes back. Okay? And then there's organic and then psychogenic. Organic is when there is a true biological basis. I'll go back to that example of cancer. You have a growth, something that is there that shouldn't be there, you're typically going to experience pain. If something is not there that should be there, you're going to experience pain. Anything that's not the status quo in the body, you're going to have pain. It's a signal to us. And then there's psychogenic, meaning a lot of times where we are emotionally impacts how intense the pain is. Okay? I'm going to give you an example. Childbirth. Most women at the time report high levels of pain unless they have an epidural or other, Stadol things to help alleviate the pain. But they say, high levels of pain. But immediately after that baby's born, that pain is not interpreted as intense. And in fact, women joke about it, right? They joke about it. But when they look back on it, yeah, it was the worst pain I ever experienced, but they're saying it with a smile. Okay, so there's that emotional attachment to the pain that actually makes the pain more acceptable or more agreeable or more tolerable. Make sense? Okay. So what are the characteristics of pain? When you go speak with your doctor about pain, these are the identifiers that should be assessed by a physician. If they're not asking these questions, this is the information you should be offering, okay? Because a lot of times it's really hard to figure out where the pain comes from, kind of the chicken and the egg phenomenon, because you hurt one place and then you compensate your posture or how you walk and you end up hurting in another place. Make sense? Anybody ever have that experience? Okay, so location. The first is it localized or is it referred? Localized means your shoulder hurts because something's wrong with your shoulder. Make sense? Your hip hurts because something happens with your hip. Now, referred pain, this is a little trickier. Referred pain is typically when there's something going on, say with one of your internal organs. I always joke, why did we call it internal organs? Because organs really aren't on the outside, except for the skin. But your internal organs. So you have these internal organs, and if something's going wrong with them, typically they express pain somewhere else. So for example, when you're having problems, say with your heart, you don't have a pain in your heart, right? For a lot of women, they express it in their left arm. What's a common signal of a heart attack? Left arm pain, right? Jaw pain. That's called referred pain, where something is felt elsewhere than where it's occurring. Make sense? Okay? Intensity, the magnitude or the amount of the pain experienced. And then there's something called threshold and tolerance. Threshold is how much of the stimulus, how much of the event has to occur before you feel pain, before you interpret it as pain. Because until it's felt as pain, it's just considered touch or feeling. Make sense? Have you ever touched something? And I always give the example of like a stove. And you touch a stove, and for that half second, you don't know if it's hot or cold. You ever had that experience? You don't know, but you have a reaction to it. That's because the threshold hasn't been met yet. The threshold is when you start to feel pain. Tolerance is exactly what you think of. Your ability, what is the highest level that you can tolerate of that pain before you say, no more, I need an intervention. There's huge range, huge variability in tolerance. And within the individual and between individuals. The one individual can have a very high tolerance of pain for certain things, but not have very high tolerance for other things. So let me give you an example for me. Pretty much blood draws, all this stuff, that doesn't bother me. Puncture me, whatever, I'm okay. I'll be like, yeah, that hurts. Stub my toe, it's like the worst thing that's ever happened in the world because that pain And we're going to talk about that. You stub your toe and you're like, wait for it, this is going to hurt. This is going to hurt. And then, you know, it's that dull aching pain. I don't like dull aching pain. Acute pain or that piercing pain doesn't bother me so much. Some people it's reverse. We each are very unique, kind of like your fingerprints, on how you interpret and feel pain, what your threshold is, what your tolerance is. Then the quality, how the pain feels, how you describe it to somebody else, and temporally, when it starts and how long it lasts. So these are very important descriptors when talking with your doctor. So I told you I was going to talk a little bit more about acute versus chronic pain. So as you see, and I think I might mess this up, maybe not. I don't know if it has a pointer on there. We're just going to pretend that I'm pointing. So you'll see where acute says onset is abrupt, chronic is gradual, meaning it's slow. I kind of call chronic pain insidious. It's a slow creeping pain that comes on slowly over time. Duration, acute pain, literally from 1 second up to 6 months, whereas chronic pain is longer than 6 months. Intensity, they can both be mild, moderate, severe. The etiology or where it comes from, typically acute pain has this more biological reason. You can identify where it's coming from. Either there's been an injury or something's going on, whereas with chronic pain, it may not be easy to figure out exactly where that pain comes from because a lot of times that pain migrates. Maybe the person has it in their neck for a while, then it's in their shoulder, then they're having migraines for a while. So it kind of moves around the body. Now it may be more, usually if it's upper torso, it stays in the upper torso. If it's lower torso, it stays in the lower torso. But with chronic pain, it can kind of float around a little bit, which can be very difficult to figure out how to treat. And then the physical response with acute pain, you have the fight or flight response. And we're going to talk about that in a second. But this is when you have the increased blood pressure, heart rate, respiration, dilated pupils. You have all the things associated with kind of a threat, a true immediate physical threat. Whereas with chronic pain, you don't have those symptoms. Your body has recognized that maybe it's not a life-threatening event, so it has dulled it down. Make sense? Okay. All right, pain perception. This is about as scientific, with big scientific words, as I'm going to get in this, because I can tell you the pain literature is very deep, but it's not very broad. We really don't know that much about pain, but we do know that there's substances, they're called algogenic substances. These are chemicals that are released when you have an injury. Some of these things are like dopamine, serotonin. These are neurotransmitters. We have neurotransmitters, which are brain chemicals, that some are excitatory and some are inhibitory. Okay? They do one or two things. You also have other things like hormones that are released. One of the ones that's a wonderful one that's released is something called endorphin. Have you guys heard of endorphins? This is a good one to release when you're in pain because it actually makes the pain go away. It's called biological anesthesia, basically. It basically makes the pain go away. It's naturally occurring. So typically when people, unfortunately, are suffering extreme pain, like if a person is just traumatically injured, at some point the body recognizes that emotionally and physically we can't handle that, and it turns on this endorphin response, and people report, if they survive, that they didn't feel anything. It's truly an amazing reaction that our body has. It's truly wonderful to have, but we hope that we never have to experience it. Then there's these things called nociceptors. Basically, they are specific neurons or cells, and neurons are basically these cells in the spinal column in the brain that are specifically for pain. All they respond to is pain. This is new. This is in the last 20, 30 years. We really didn't know this. And then referred pain we talked about. What are other factors with pain perception? Well, there's ethnic and culture values. Some cultures it's important to express pain. In other cultures, it's important to not express pain. You have environment and support from people. If you have people around you who are supportive and nurturing and who give you some empathy and sympathy, sometimes the pain is not as bad versus having a support system that says your pain really doesn't exist. It's all in your head, right? It doesn't matter. Get over it. Take an aspirin, right? Why are you laying in bed with a migraine? Just take something. It can't be that bad, right? Isn't that the most annoying thing when someone says it can't be that bad? And then past pain experiences. If you've had that experience of pain before, you have the distinct memory for it. And typically, you're going to match that level of pain to that memory. So if you've had a past pain experience that was really excruciating, if you feel that migraine coming on or that lower back pain, you're going to think and assume it's going to be that same level of pain. Okay? And then what the meaning of pain is to you. There's spiritual and social context to that. So there's 3 different, and this is kind of wrapping up the pain literature, theories of pain. There's the specificity, the pattern, and the gate control. This is really fabulous. So specificity, basically, it's been debunked. We know that it's not true, but we used to think that we had 4 types of receptors. One for hot, one for cold, one for touch, and one for pain. Okay? And one nerve responded to one type of thing. So, for example, if you stuck your toe in a fire, the fire or the heat receptor would send that to the brain and say hot, hot. Okay? Hot, hot. We know that's not the case now. Then there's the pattern theory. This was the next one that came up. And it said that there are no specialized receptors. So it says that last theory doesn't exist. But it said that there's one type of nerve. And basically what it does is as soon as it experiences it, it figures out if it's hot, cold, whatever. We realized, well, that's not accurate either. Then we've come up with something called the gate control. This is now the existing theory of pain. And this is where the first time emotional and psychological factors were introduced. So emotional health aspects to pain were introduced with regards to pain. So basically it said there's a physiological and a psychological factor that can affect the experience of pain. There's this thing called a neural gate. I'm going to show you something in a second that can open and close, which allows pain in or doesn't allow pain in. And the gate is located in the spinal column. Okay? So let me show you. So you have an injury and you have this gate, and it says there's physical, emotional, cognitive, behavioral things that open or close this gate. And then the pain experienced depends on how much that gate opens up. So let me show you. This is the gate control theory. You have this gate, and I'm sorry I just can't figure out the pointer. Right here you see the gate is open. That means the pain signal that starts is being allowed to travel up the spinal column to the brain. So if that gate is open, you're going to feel pain. If that gate is closed, you're not going to feel pain. Okay? Very simply. Gate open, you feel pain. Gate closed, you don't feel pain. So, yes?
How is the gate to open and close?
I'm going to tell you that. Nope, I love it. I love questions. We're going to get right to that. So, basically, what opens the gate? When you have those neurons that detect pain, when those get activated, you stub your toe, you have a migraine, something happens, you have an injury, that starts to open up the gate, okay? But there's other things that can close the gate. Medication, for one, works on closing the gate. When you get an epidural, we talked about childbirth before, that closes the gate. That blocks the gate. And basically, it doesn't allow that transmission to occur. So we talked about other sensory nerves, and I'm going to talk about this in just a second, but let me give you an example of it. So you stub your toe, right? And, you know, the toe to the brain is about as far as a message can travel, and it travels pretty slow, okay? Because when you stub your toe, there's a difference between, you know, puncture pain and dull pain and things like that. But you stub your toe, you know, your toe didn't fall off. It didn't get cut, anything like that. It just got hit, and it hurts. But you know how it takes a long time for that pain to be interpreted. You say, oh, it's going to hurt, and then like half a second later, you feel it. Now, what do you typically do as soon as you stub your toe? You grab it, right? You grab the toe. And that's because when you do other sensory things, other touch, that can help close the gate. When a person breaks their arm and they get up, the first thing they start doing is rubbing their arm, okay? They start rubbing the arm because with that sensitivity, that massage actually tells the gates to start closing, okay? So anytime you ever notice that you have something that hurts, your first instinct is to rub. If you've ever touched a stove, right, you actually remove your hand before you actually interpret the heat. That's a good thing. That's a fast receptor. but you touch it, what's the first thing you do? Right? It's instinctive. You're closing the gates if you do that. You press, you hold on, you're trying to slow down. So when you do something like that, you're closing the gates. Now, what causes the gates to open? Well, the injury itself or the pain going on or inappropriate activity level. Let me tell you something. When our bodies, when we use them up, we get to the point where there's a good amount of usage of our body, and then we start to overuse our body. And we start to exert our body. And when you have overusage of your body, you're going to feel more pain. It's quite simple. It's met its threshold. So anything you do over that is overactivity. Emotional conditions. If you are worrying, if you have anxiety, if you have tension, if you have some depression, anxiety, that is going to cause those gates to stay open automatically. So when you are anxious and you hit your toe, that hurts more than when you're not anxious and hit your toe. Because that anxiety is allowing all those gates up the spinal column to remain open. Mental conditions, focusing on the pain. Sometimes the more you focus on the pain, like, oh, that really hurts. Oh, that hurts. That hurts. Well, of course it's going to hurt because you're paying attention to the pain. Whereas distraction can sometimes be more beneficial. And then, of course, believe it or not, if you're bored, things hurt more. So physical conditions that close the gate, medications, counterstimulation, heat, massage, we talked about that. If you've ever had like a neck pain or shoulder pain, you put that the heated blanket or something and it immediately starts to feel better, that's because you're closing gates, okay, down the spinal column. And it's not instantaneous, but you start to feel, and then you start to move a little bit more. And the more you move, that's called that counterstimulation. So the more you move, you're starting to close more and more and more of those gates. Emotional conditions, if you're remaining positive, if you're relaxed, if you're rested, that's going to help keep those gates closed. I joke that's why, a lot of women, after they have childbirth, they say their emotional condition is they're so just elated with having a child and the baby's here and, just that connectedness, that those positive emotions are closing those gates up very quickly. Okay? Mental conditions, intense concentration. So not just focusing on the pain, but I like to say talking to the pain and telling the pain to stop. When you say, I know this hurts, but I have control over the pain. And you almost have some imagery of, I'm closing each gate up my spinal cord. I am closing each gate. Every gate that I close, you feel less and less painful. So talking to the pain and being very specific with it, or distracting from it. You're either a person that has to look at the needle going in your arm when they take blood or look away. You're not in between. There's no one's like this. You're either a look away or you got to look at, am I right? Look at it or look away. You're one or the other. It doesn't matter which one. One's not better than the other, but no one's like this. Okay? And then involvement and interest in life activity. So just having things outside of your pain. So biopsychosocial model, this was a new concept that was really developed in the 70s that said, wow, this new gate control theory says that the way we are emotionally has a huge impact on our interpretation, the intensity of our pain, where we feel pain, how we feel pain. There might be something to this because we used to believe that the mind and the body were completely separate, right? Completely separate. And now we realize that they really have this symbiotic relationship. They work together. So what you think about, you bring about, right? And also what happens to you changes your thinking. It's a two-way street, okay? Yeah, I mean, you get shot in the arm, it's going to hurt. You're going to have a mental interpretation of that. But how long do you hold on to that interpretation? How long do you hold on to that emotion? If you quickly rebound, or if you reframe it to be more positive, you'll experience less pain, okay? So they looked at how the mind, body, and your environment around you interacts to cause different mental states. And then this is really where the model, and this is a model that I live by, is you don't treat the disease, you treat the person, okay? Because usually if you try to treat the disease, you're going to be chasing the dog's tail. Because you're never, always something else is going to pop up. So this is what it looks like. There's this biological process that's going on. then you have these social processes, and then you have psychological processes. And they all kind of go in this circle together, okay? So you may have a lot of emotional distress going on, which means if you have a slight injury or change, that's going to occur, right? We know that there's a strong literature between things like stress and your immune system. When you're high levels of stress, your immune system's low, so you're going to have more illness, more flu, things like that. And then social process. So if you don't have a good social support, or people that say, hey, take care of yourself, you need to go, take care of this, or I'm going to support you, versus I don't understand why you can't go to work. I don't understand why you can't, supportive versus unsupportive. All these processes work together. So pain, you'll see in the middle. So when I conceptualize pain, and when I talk with people about pain, I always want to know those questions, the quality, the temporal, the threshold, the intensity, all of those things. But, those are the biological factors. But I also need to know what's going on psychologically for them, socially for them, and spiritually for them. There's actually a very strong amount of literature that shows that people who are spiritual, and I'm not saying one particular denomination over another, not that, but spiritual meaning people who will use either higher order power or meditation processes or something like that, experience shorter durations of pain and less intensity. That's why you see a lot of people doing yoga and diaphragmatic breathing. We're going to talk about these things, but they do seem to work for people with pain. So you have to look at the kind of the comprehensive picture when it comes to pain, whereas a lot of times, a lot of physicians, no fault to them, they just want to focus on the biological, right? That's what they're good at. You tell me where it hurts and I'll give you a medication. Typically, though, they're treating the symptom, not the cause, right? So this is a typical pain cycle. Tell me if anybody's ever experienced this. So you're in pain. So pain and anxiety make it hard to sleep, and lack of sleep makes the pain worse, and then it makes you tired, right? And then your mood makes you angry, have anxiety, depression, which these feelings make it more difficult to cope with the pain. And then you haven't slept, you're in a bad mood, the pain and lack of energy makes it hard to be active. And the less active you are, it's called use and disuse model. The more you don't use something, it dies, it atrophies, right? If you've ever sat in a chair for 8 straight hours, and then you stood up and you went, oh my gosh, right? I'm so sore. Why is my body so sore? Because it's not supposed to sit that long, right? We're not meant to be that way. But disactivity and activity, and then energy. Coping with the pain drains your energy. So it's this cycle, right? This huge cycle. And I'm very passionate about stress and sleep as well, so I had to put sleep in there. So moving on. So we talked about the cycle, right, of pain, and we've talked about the biopsychosocial. So let's tune in on some of the more emotional aspects of it. So you have these thoughts, these feelings, and the behaviors. I talked about what you think about, you bring about, right? I also like to call it stinking thinking. That's what I call it. But when you have negative thoughts, whether they have a true cause or not, and I'm not talking about walking around the world with rose-colored glasses on. I'm not talking about that. I mean that we walk around with a tendency to have more negative emotions and negative thoughts. But you cannot have an emotion without thinking it first. I'm going to say that again. You can't have an emotion, you can't feel a certain way unless you think that way first, okay? And I mean emotionally. If you have a biological reason, you have a biological reason for the feeling. But remember, there's a huge range. You can make it can feel more intense or less intense, and how you emotionally view that pain and causes that intensity to go up or down. So how you think leads to how you feel. And then when you feel a certain way, you act a certain way, right? So let me give you an example. So you have, let's say, migraines, regular migraines. And one thought maybe is, I can never do what it is I want to do. I feel like I have no control over when I'm going to have this pain. I feel like I'm a prisoner in my own mind. Is that a reasonable statement for a person that might have a migraine? Okay, so what kind of thinking, what kind of feeling would that give you? Would you like, yay, I'm so excited to have migraines. I feel thrilled, right? Or are you going to say, you know what, what's the point? What's the point and even trying, you know, if I do something, I feel anxious. If I go out, I feel down. Your mood is just bleh, right? And then how do you act? Do you act around, everybody want to be your friend? You're like Miss Mary Sunshine? No, right? You end up doing less because you're not interested in doing anything. So it's this cycle that goes wrong. So how you think can really make you feel a certain way, and then in turn determine your behavior. So it can be a very vicious cycle. So talking about stress, because stress has a very important part in that cycle. So we know that stress is a major culprit. And I would say to most people, when they come in and they say, I have migraines, or I have neck pain, or I have shoulder pain, or I have hip pain, or whatever it is, I always say on a scale from 0 to 10, 0 being not at all and 10 being the most intense pain that you could ever imagine experiencing, and you can't say 5 because that's a chicken answer. Because, you know, everybody would choose 5 because that's middle of the road. It's non-committal. So I'm going to make you commit to the lower end or the higher end. I would say, how intense is your pain right now? Or how bothersome? So they give me a rating on their pain. I would say, now, how much does your pain bother you on 0 to 10? Okay. How much does it bother you emotionally? Okay. And you will find that the higher the emotional level that it bothers them, the higher the rating of the pain, okay? So if we can't fix the pain where it's coming from, let's recalibrate the emotion. Let's give some strategies there, because then that will help bring down that interpretation of how it feels. Make sense? Okay, so stress is a huge culprit with that. And about 43% of adults suffer adverse health effects from stress. 75 to 90% of all physician office visits have a stress-related component. So there's cardiovascular disease, and then for a lot of people that have shoulder, neck, hip, things like that, then the musculoskeletal disorder. So muscle pain, right? And then psychological pain, workplace, and then just I put pain in general on there. Because we know that the higher level of stress that you're experiencing, the more intense your pain is. That has been very well documented. So what is stress? Well, we know it's a common experience. And just briefly in the time that we have, there's internal versus external, major versus minor stress. Just simply, internal stress is the stress that you feel inside yourself. It's the talking that you do within yourself. It's the self-talk that you have. External stress is everything else that's going around you. Traffic, weather, bills, politics, whatever it is that gets you going. That's the stress. That's the world around you. Internal stress is the shoulda, the couldas, the wouldas, and the ought tos. Do you know what I mean by the shoulda, the coulda, the wouldas, and the ought tos? I should have done this. I could have done that. I ought to do this. Like, just imagine a whip and a chain when you're saying that, because that's what you're doing. Of the two, internal versus the external, which do you think has a more detrimental impact on your health? Internal. Of the two stressors, which do you think makes pain interpretation go up? Internal, right? So major versus minor stress. There's major stressors and minor stressors. Major stressors are those big ticket items that don't occur that frequently in life, but they do occur. Death, birth, buying a home, retirement, all those things that happen, but they don't happen with a regular frequency. Minor stressors are all those other things in life. You go to the Walmart, you say, hey, how are you doing? And the cashier grunts at you, right? You have your turn signal on to go into a parking space, and some little, looks like 12-year-old something or other scoots in and goes, sorry, you know, whatever. One of those, you know, those daily hassles in life. Now, I guarantee it's 10, 15. You've had at least a dozen daily hassles already. Probably all just checking in today, like waiting in line. I mean, that's, you know, these are things that we're not good with. How many of you walked in and saw the size of the room and were looking for a chair and went, oh. Daily hassle, right? Oh, just those little things. Of the two, major versus minor stressors, which do you think has a more impact on your health? Minor. Which do you think causes your pain to be interpreted as higher? Minor. And let me tell you why. We talked about the importance of support system earlier, right? So what's the importance of a support system? When you have a big ticket item happen, typically people rally around you, right? You have a death in the family. People say, I'm so sorry to hear about your loss. Anything I can do for you? Here's a casserole. You know, I'll call you tomorrow. Let me vacuum. You know, we give of ourselves and we accept from people. We really accept that help. Now, when was the last time someone said to you, I am so sorry traffic was bad on Perkins for you. If there's anything I could do, let me pick you up. And then I'll fill up your car with gas and I'll wash it for you. No, we don't do that, right? If anything, with the minor stressors, we one-up each other. Oh, you thought your commute in was bad. Well, I live in Prairieville. Or, you know, oh, you know, you thought you had to wait a long time in line. I was here at 6 o'clock and it was 20 minutes before they opened the door. Whatever it is, we always have to one-up each other. Whereas we would never say, oh, I know you loved your Aunt Susie, but I loved my Aunt Jane so much more. We would never do that, right? We don't allow it. But what I'm saying is there is that support system around you that if it were in your world, your pain is major, but in their world, it's minor. So they treat it as a minor stressor, which means they're going to one-up you, not really give you a lot of support about, and kind of, you know, basically in not so nice terms say, suck it up, right? That's what they're telling you to do, and you're like, this hurts. I hurt, and when I hurt, everything hurts. My mind hurts, my body hurts, my teeth hurt, everything hurts, and I don't understand why you don't understand. They're not going to get it because that support system isn't in place. Because they're going to, I don't want to say one-up, but they're not going to recognize the importance of it to you. So we talked about the fight or the flight system. And you know when I put that thing up that said the acute stress, I said you have an increased heart rate, respiration, everything like that. Fight or flight, very in basic terms, is that your body has a response that occurs when it thinks it's in a life-threatening situation. You see a snake in the woods, your body's going to respond in one of two ways. You're going to run away, or you are going to kill that snake. And you're not just going to kill it, you're going to overkill it. You're going to like chop it up, get in the car, run over it a couple of times, get out, check on it. You're going to kill it, you know. And so it's a fight or flight. And what happens is the body gets activated, okay? It gets very activated. So it rushes a lot of blood, a lot of stress hormones, and it says be ready to fight or to run away, okay? Now what happens is that you have things like cortisol released and adrenaline and epinephrine, and unfortunately it makes your immune system go down when this happens. So when you are in high levels of stress, your immune system is down. And if your immune system is down, what do you think your perception of pain is like? Right? So you're walking around with all these daily hassles, and you wonder by the end of the day why your pain has gotten progressively worse, right? It may have nothing to do with the biological state of the pain. It may be about the environment around you. So the fight or flight, it's very hard that once the system is activated, it takes 10 or 15 minutes for it to come down. If you've ever really been scared in the moment, like somebody really scared you, and you did that, and then your heart was racing, and you were kind of cold and clammy and shaky, and, you know, for a while, and it took about 10, 15 minutes. Well, that's how long it takes those chemicals and hormones to go through your system. Now imagine if every little thing, every little daily hassle triggered that response. Your system's going to be elevated and activated all day long. Your immune system is going to be down. Okay? Problem is with daily hassles, once the body thinks there's a threat, it's like a light switch. It doesn't know if it's a snake in the woods or traffic. If it's activated, it's activated. So a lot of it is about how do you reduce these fight or flight responses. So this is just, I think, an example of flight or fight. My baby's on the right, my sister's is on the left. They're 8 days apart. So Claire on the left is total flight. You see, she's trying to jump out. Mine is total fight. He's a little soldier boy. He's rigid. He's ready to stand guard. This is, I mean, truly, I mean, you don't get these responses, and everyone's like, that's so cruel. We thought it was hysterical because it is so biologically true. Mine has, you know, no color, whatsoever because there's no need. Biologically, why do you need blood in your face? You need the blood in the limbs and the torso, right? So, I mean, that was just, to me, I was like, that is the flight or fight response. So we know that there's 3 components to stress. There's the physical, the behavioral, and the cognitive. How our bodies feel when we're stressed. How do your bodies tell you you're stressed? What do you think the number one thing that people report when they say their bodies are stressed? Category of pain. Neck, shoulder, head pain. So neck up, you know. Basically, there's kind of an old adage that you're either, you know, you hold your stress in one of 2 areas. You hold your stress in one of 2 areas. You're either a pain in the neck, meaning shoulders up, or you're a pain in the... Okay? And believe it or not, we do carry a lot of stress in big muscles back here. So if you've ever had like a true therapeutic massage, you will know if you carry stress and tension there because you will jump off of the table if you're with a massage. Quite honestly, we think we carry all this pain here because it's very normal to. But remember, you're either upper torso or lower torso. Very rarely are you both, right? So just, you know, be thinking, are you a pain in the neck or, you know. But so how our bodies feel, how we act, and then how we think. Remember I talked about how it's a circle that goes together. So common symptoms, headache, muscle tension. Those are the big 2. And that, like I said, usually it's the shoulders, neck, and head. So how do we combat stress? Because if we bring down stress level, right, we increase the immune system, we decrease pain, and our interpretation of pain. So I always say the first thing, obviously, you know, we could have talked about medication effects, we could talk about a lot of other things, but let's focus on kind of these behavioral things that you can do. Well, one, you want to recognize what is stressful in your life. What do you have control over and what do you not have control over? You want to kind of elicit as much social support as possible. You know who your friends are. And I always say, you know, just because a person's your friend doesn't mean they're necessarily supportive. Because there are friends who are sabotagers. We love them nonetheless. And then there's friends that are supporters. So when you are in pain, do not go to a sabotager. Go to a supporter, right? Because you really are the 5 people you spend the most time with. Some of those people you can't get rid of. Some of those people, you know, we talk about toxic people in your life. It might be time to weed the garden of social support and bring in those who are. Time management, assertiveness, relaxation techniques. We're going to talk about this in a second. Exercise. This is a hard one because when people are in pain, they say, I don't feel like being physically active. I don't feel like exercising. I say, let's take a step back. Let's talk about, remember, this use and disuse. If you don't use it, you lose it, right? It goes away. So what people want to do is get out there and walk for 30 minutes. And I'm like, well, have you ever walked for 30 minutes in your life? If you haven't, and you're in pain, you're certainly not going to do it now. Let's go 2 minutes. Then after a week, build to 5, build to 7, build up slowly. You always want to progress slowly. Getting enough rest and sleep. Most people say, oh, I have trouble sleeping. I get that. And, you know, sleep hygiene is a whole other thing when it comes to pain medications. But what I say is if you are resting the body, you're in good shape. So we have 2 minutes? 2 minutes, okay. So other ones, and just so you know, all of this, it is going to be on the Pennington website, the Women's Wellness website. So, but I want to talk about these things. Diaphragmatic breathing. In the 2 minutes we have left, I'm going to help you do the most cost-effective thing possible for you. I'm going to help you learn how to breathe better because you breathe, most of you breathe incorrectly. See, if you've ever watched a baby in a crib, you notice one thing. Their tummies go up and down, right? They breathe from the diaphragm, the muscle underneath the lungs. As we get older, we think we're smart and we start to breathe through our mouth like this because there's a bigger hole than these 2 things, oh, right? That's not how we're programmed to breathe. So appropriate breathing, and I'm going to model it for you, and I promise you, if you practice this and get used to doing it, not just when you're stressed, but get used to breathing this way all the time, it will be an automatic stress reducer and is the #1 recommended thing for pain management. Okay? So the first is you always want to breathe through the 2 small holes and then out by the bigger hole. You don't want to go, that is not effective breathing, right? That is not effective breathing. You want to breathe in slowly through the nose. You're going to hold it for what's comfortable. Don't ever feel like you're holding your breath, but just allow the breath to come in and then exhale slowly. I want you to imagine you have a spoonful of soup in front of your face, and you are to smell the soup and then cool the soup. That is the level of in and out. Just learning to do that. And for a lot of people, it is very difficult to do. I don't care if you're a mouth breather, non-mouth breather, it doesn't matter. You can do this. But if you practice this 10 minutes a day in the morning and 10 minutes at night, 1, in the morning it will wake you up. 2, it'll put you to sleep in the evening. Okay? But retraining your way of breathing helps recalibrate the system. And by doing that, you reduce stress automatically and also help reduce the pain that you're feeling. That's time. That's time. So, oh, thanks. So, I'm going to be around after the next one if you have any questions, concerns, anything like that. Is the next 10:45? So, yeah. So, I'm here.